So I will begin with introduction. What is Mercy Malaysia? Mercy Malaysia stands for Malaysia Medical Relief Association. This is the non-profit organization that focus on providing medical, humanitarian aid to communities affected from the natural disaster, conflict, or poverty. And who is the founder for Mercy Malaysia? The founder for Mercy Malaysia is Tan Sri Dr. Jamila Mahmud. This is a doctor from obstetrician and gynecologist department and moved to her medical services voluntary. Mercy Malaysia also has over 500 members and also has 7,000 volunteers registered in their database. And usually the funding and the donation is from generous organization or individual to continue their service of providing humanitarian aid to recipients both in Malaysia and abroad. So for your information, this organization, Mercy Malaysia, has provided humanitarian aid and program in 32 countries. So the countries mostly from Kosovo, Indonesia, Iran, Afghanistan, Japan, China, Thailand, and more other countries. So just for these 20 years, Mercy Malaysia has been helped them. And now let's move on to the next presenter.
Mercy Malaysia have implemented several programs. The program that we had chosen is Myanmar Flood Response Program. Mercy Malaysia began executing several initiatives and programs in Myanmar in 2008. This includes programs for cleft lip repair, disaster risk, reduction, water sanitation and hygiene, primary health care, and health facility rehabilitation and reconstruction. Mercy Malaysia offers medical aid to Myanmar communities who was affected by the flood. A state of emergency has been imposed in 4 western provinces of Myanmar because of severe flooding both on the monsoon rainfall. The objectives of the Myanmar Flood Response Program is for all communities with whom they are engaged to be highly resilient in the face of a disaster. High resiliency will allow communities to recover more quickly after a disaster, thereby lowering the impact of disaster on their livelihood throughout the response and recovery phase. Other than that, Mercy Malaysia Flood Response is in Myanmar seeks to address the need and vulnerabilities of the affected population, coordinate with local authorities and other international organizations, deliver immediate humanitarian aid and support long-term recovery and resilience building initiative in Myanmar. With this action, Mercy Malaysia hopes to enhance the capacity and general well-being of the impact communities, increase their ability to withstand future calamities, and encourage long-term sustainability and independence in Myanmar. Mercy Malaysia has allocated around RM1 million in next 12 months for these flood programs.
So now I will present about the contribution of activity of program that Mercy have done for the Myanmar flood program. So for first one is medical relief. So Mercy Malaysia actively participate in delivering emergency medical relief. There's a team to the impacted communities to provide food, housing, medical attention, and other necessity. Mercy Malaysia has deployed its emergency response personnel and volunteers to offer essential assistance to Myanmar flood response program. The humanitarian support concentrates on emergency health support, will encompass mobile clinic and the distribution of hygiene and dignity kit to individuals who have been displaced. So the next one is humanitarian aid. So uh, the contribution of Mercy for helping Myanmar during the flooded, they give a humanitarian aid, such example providing aid and support healthcare infrastructure and addressing the need of displaced population. In 2008, Mercy Malaysia had been providing humanitarian aid to the victim of flood in Myanmar, such as distribution food and non-food items, conducting medical camp and building two healthcare centers there to cater the medical need. It showed that Mercy Malaysia is not only giving medical and humanitarian aid to Malaysian country, they are also giving it to other countries that need it. So the third one is sustainable health development. So these activities sustainable health-related development such as educate the people about all the dangerous disease and ways to avoid it. During the Myanmar flooded program, Mercy Malaysia have provide mobile medical service and health education to the flood-affected people, especially in Kalai, Sanghayan Division and Nayuang Kon village. This is because the local have strong traditional medical belief and cleanliness practice, which make it difficult for them to use modern medicine or modern method. During the mobile clinic health education season, were also conducted on topics such as prevention of communicable disease, nutrient good hygiene practice, and how to use Medikit mosquito net. So the last one is risk reduction. So the contribution of the activity can make a point or data which can help the Mercy Malaysia to prepare if the flooded happen again. So they use the total disaster risk management, which is approach to their work, which apply disaster risk management to all the phase of the disaster management cycle, from emergency response to recovery, prevention, and preparedness. So that's all for me. So I will pass to the next presenter.
They asked what for Myanmar flood response program. I will explain about the strength. The strength of the Myanmar flood response program is to focus on the building resilience within companies and its emphasis on local participation and collaboration. This program's strength is that it emphasizes local engagement and collaboration while focusing on fostering community resilience. Mercy Malaysia makes sure that the flood relief operation and customized to the unique needs and capacity of each community by collaborating closely with local organizations and community people. By empowering the communities to take charge of their own resilience building projects, this strategy not only improves the efficacy of the flood response. To sum up, Mercy Malaysia Floods Response Program is strong because it takes a holistic and community-centric strategy that emphasizes community engagement and collaboration, long-term resilience, building initiative, and urgent relief. Next, I will pass to the next presenter, which is it will present about weakness.
Now let's look at weakness analysis. There have 3 weaknesses for this program, which is first is access to the village. For your information, there are many villages that have to be visited by the boat because of the flash flood that will cause the road to be cut off and the bridge that time so damaged. So access done by the volunteering to help the villages is quite difficult and so challenging for that time, and it's not all area can be explored because the area is so bad due to the flooding that it cannot be passed by the volunteer. Therefore, not all Myanmar people at that time got the help they deserve. And for the second weakness is communication problem. Usually, Myanmar is very ethnically diverse country with 135 different ethnic groups recognized by the government. The majority of the flood affect people in Sagaing division are from the Chin ethnic group who communicate in their native language. Mercy Malaysia does involve local volunteers to implement the project, but language remains a barrier. Therefore, not all people that time they will understand the Mercy Malaysia volunteer explain, even though the information is so important for that people. For the third and last weakness is lack of education. The local people have strong traditional belief when it comes to hygienic and medical practices. This is because the people will oppose everything that the medical team says because of the strong belief of the people. Therefore, it will pose a challenge for the medical team to overcome. Not only the physical will be reduced, but it will play with the mental problems of the medical team. Maybe death will reach the new people, or the people will realize the importance of the knowledge that will delivered by medical team is so important that time.
So hi, my name is Suka binti Muhammad and my student ID 202110047. So I will present for the opportunity from this program. So next, for the opportunity, it can provide opportunities for economic cooperation with brotherhood between countries to strengthen economic cooperation through free trade, joint investment and the development of economic project. Also, nation can cooperate to solve challenges and realize shared objectives by sustaining fraternal ties.
In 2017, the medical teams of Mercy Malaysia provided healthcare services to 63,636 patients in vulnerable communities at 10 locations, which are 3 static clinics and 7 mobile clinics in Situi. In 1986, the Kelantan Rural Health Center started the operation as a station hospital with only 1 doctor, 1 trained nurse, 1 compounder, and 1 midwife. However, the mobile clinic are also risky to the health worker who is involved. During the floods, infectious disease are one of the things that always happen to people who are affected by floods. For example, cholera, conjunctivitis, dengue, and waterborne diseases. For first recommendation is improve education quality. A lack of education is described as a situation in which individuals have a below average common understanding of essential items that they will urgently require in their everyday life. One of the ways to improve education is the government and organization should work together to ensure that education is accessible for all people in Myanmar, regardless of social economic background, gender, or geographical location. According to Muhammad Iqbal Omar, in Myanmar, they still use traditional belief when it comes to hygienic and medicinal practices. In these modern days, traditional beliefs are already out of date. They need to learn more about modern medicine because modern medicine has done much in the field of infectious disease and emergency to aid cure. So in order to improve education quality, the government needs to create one program, for example, teacher training and professional development programs. It can provide educators with the skills and knowledge needed to create engaging, effective and personalized learning experience for students. This program can include such as workshop, seminars, and training session.
So now I'll be explain about the second recommendation, which is the strengthened collaboration between all stakeholders involved, including the governmental agency, non-governmental organization, and local communities. For instance, equipping communities with the know-how to operate early warning system to lessen the effect of flood. The program will be better prepared to save lives. Overall, increased community resilience, a cooperative approach, and sufficient financing and resources are needed to strengthen the flood response program in Myanmar. So that's all I will give to the next.
Last but not least, it emphasized the extension of services beyond the initial timeline to meet the need of those affected from the floods, including running mobile clinics in rural areas and IDP camps benefiting an estimated 6,000 people, and additionally it outlined the challenges faced during operations such as a limited access to village communication on barriers and the needs to overcome traditional belief and practice. So that's all from my group. Thank you.